Hello friends. Today I am going to discuss about deep vein thrombosis DVT. Deep vein thrombosis sometimes should be dangerous. What is DVT? DVT is formation of the blood clot in deep veins. DVT occurs in pelvic veins or deep veins of lower extremities. DVT is most common after hip surgery. This is a normal blood flow. This is deep vein thrombosis patient blood flow. What are the causes for DVT? Injury to internal veins. Venous studies. It is problem moving blood back to the heart. Hypercoagulopathy. It is excessive blood clotting. Polycythemia. It is a type of blood cancer. Bone marrow. Increase production of red blood cells. High risk person for DVT. Obesity persons. Cancer persons. Smoking person. Prolonged standing persons. Over 60 years person. Pregnant mothers. Prolonged bed rest person. And long-term use hormonal tablets persons. Example as estrogen. Signs and symptoms of DVT. Edema. It is the most specific symptoms. Leg pain, tenderness, warmth of the skin. Warm or erythema of the skin over area of the thrombosis. Mild fever. Change in skin color. Nursing interventions and management for DVT patients. Number 1. Encourage to leg exercises. Avoid rubbing or massaging calf and tight muscles. Avoid standing or sitting prolonged time. Avoid inserting IV catheters into the legs. Post-operative patient. Well hydrated. Apply stockings. Assess distal peripheral pulse, capillary refill times, and sensation of the lower extremities. Today our lesson is over. Like, comment and subscribe our channel.